Om Swastiastu. Greetings to all the viewer. I'm Dewa with the last student registration number is 101, and I'm going to be the moderator for today's presentation. In this great opportunity, we are going to be presenting our student project on basic pharmaceuticals, medicine, and drug ethics. And here are our group members. And here is our case.
Thank you for the time. Hello everyone, my name is Sashikirana with Julyvia student number 087. The most likely problem in this case is a vaginal yeast infection, often known as candidiasis. The symptoms of vaginal itching and a thick white vaginal discharge are indications of yeast overgrowth in the vagina. The use of antibiotic amoxicillin can disturb the body's natural balance of bacteria, including beneficial bacteria that help limit yeast growth. This disruption might result in an overgrowth of yeast, which causes the patient's symptoms. Okay, that's all from me. Thank you.
Let me introduce myself. My name is Farrell Vijsma with 3 last name digit 090. So the therapeutic objectives is to provide a correct diagnosis, symptom alleviation, and successful treatment for vaginal yeast infection, thereby increasing the woman's quality of life and avoiding potential problems. That's all from me. Thank you very much.
Alright, in this instance, I'd like to reintroduce myself. I'm Dewa with the last 3 digit of student registration number is 101, and I'm gonna explain to you regarding terbinafine. Firstly, we would like to go to the pharmacokinetics profile. Well, in the absorption section, it is considerably well absorbed with bioavailability reaching to 70%. Well, in the distribution sake, it has a large volume of distribution, high affinity for lipids, with minimal bound to plasma protein, resulting to extensive tissue penetration. In its metabolism, terbinafine undergoes hepatic metabolism primarily via the cytochrome P450 enzyme system. In its excretion, it is excreted to bile and feces with the half-life of 16 to 28 hours. And in special population, especially in elderly individuals, the pharmacokinetics of terbinafine may be altered due to age-related changes in liver and kidney function. And its pharmacodynamic profile, terbinafine inhibits the synthesis of ergosterol, an essential component of fungal gene membrane. It can inhibit CYP2D6 metabolism and may interact with drugs metabolized by CYP2D6. Well, in cost-wise, it's pretty expensive, reaching to 50,000 rupiah per tube. And now, onto the drug interaction. It has a pretty extensive drug interaction, especially with imipramine, because it causes an increase in depressing symptoms, dizziness, anorexia, and sleep disruption. And also, many more you could see as the table has shown. On its efficacy, terbinafine is an antifungal medicine used to treat fungal infection of the skin, nails, and scalp, such as athlete foot and nail fungus. While terbinafine is beneficial against some fungi, its specific efficacy against the vaginal yeast infection is still unknown at this current moment. And its suitability, the use of terbinafine is not recommended in metoprolol using patient. Contraindication in patient with chronic or active liver disease and a history of allergic reaction to oral terbinafine. Although terbinafine is a pregnancy-safe category B drug, it is not recommended to use during pregnancy and breastfeeding.
Let me introduce myself. My name is Adhirendra Putranto with last 3 digit student registration number is 094. I will talk about itraconazole from pharmacokinetics. Absorption is variable and influenced by factors such as food intake and gastric acidity. For distribution, it has high affinity for lipids and is extensively distributed throughout the body. Itraconazole have high concentration at the site of infection. Metabolism, hepatic metabolism primarily via cytochrome P450 enzyme system, particularly CYP3A4. Elimination is around 16 to 28 hours throughout bile and feces, with only a small proportion excreted in the urine. Sessile population in individual with liver or kidney impairment, the pharmacokinetics of itraconazole may be altered. Next, pharmacodynamics. Itraconazole is a strong inhibitor of CYP3A4 or 5 and PGP, which can affect the pharmacokinetics of other drugs. For the drug interaction, I put in the next slide in the table. For the efficacy, itraconazole is highly effective against Candida species. However, it's not typically utilized as a first-line treatment for simple vaginal yeast infection due to its oral formulation. For suitability, cognitive heart failure or a history of cognitive heart failure due to potentially cardiotoxic effect of itraconazole. And it costs around 7,000 rupiah or fewer than half a dollar. Thank you for the opportunity. Thank you.
My name is Dewa Angelica Utami. With my last 3 digits of my name is 098. So I will explain about the clotrimazole. Start from the pharmacokinetic. Minimally absorbed into the systemic circulation, but it may be enhanced when applied to areas with compromised skin integrity or in the presence of inflammations. Limited systemic distribution occurs after topical application, and plasma concentration are generally low. When administered intravaginally, clotrimazole can achieve higher concentration within the vaginal tissue. The metabolism of clotrimazole is relatively limited compared to other antifungal agents. The elimination of clotrimazole and its metabolites mainly occurs via the fecal route. Due to its topical and local administration, systemic exposure to clotrimazole is generally low, making it less likely to be affected by age or impaired organ function. And next, with the pharmacodynamic of the clotrimazole. Clotrimazole's pharmacodynamic involves its antifungal activity, which is primarily due to the inhibition of ergosterol synthesis, leading to increased membrane permeability and cell death. Efficacy of the clotrimazole. Clotrimazole is highly effective against Candida species, including Candida albicans. And next is about the suitability of clotrimazole. Contraindicated with pregnant women and hypersensitivity patients. And side effects of the clotrimazole are itching, nausea, and vomiting, abnormal liver function test, burning sensation, rashes, hives, blister, burning, stinging, peeling, redness, swelling, discomfort, and signs of skin irritation. And the cost of clotrimazole in Indonesia started from 30,033 rupiah. That's all from me. Thank you.
Firstly, let me introduce myself. My name is Julyvia Gifensius. The last 3-digit registration number is 088. I will now explain about posaconazole. Starting from the pharmacokinetic. In absorption, posaconazole is highly lipophilic, and so absorption of posaconazole is significantly increased with high fat meal. In distribution, posaconazole has a large volume of distribution, indicating extensive tissue penetration. In metabolism, posaconazole undergoes extensive hepatic metabolism, primarily mediated by the cytochrome P450 enzyme system. In excretion, the majority of posaconazole and its metabolites are excreted in the feces, with only a small portion eliminated in the urine. In special population, individuals with hepatic impairment may have their pharmacokinetics altered. And for the pharmacodynamic, posaconazole involves the inhibition of fungal cytochrome P450 dependent 14-alpha demethylase enzyme, which is essential for the synthesis of ergosterol, a vital component of the fungal cell membrane. Hence, the fungal cell membrane's integrity is disrupted, leading to fungal cell death. For drug interaction, posaconazole interacts with ergotamine, resulting in ergotism. Posaconazole also reacts with midazolam, resulting in prolonged hypnotic or sedative effects. For the efficacy, posaconazole is not commonly used to treat vaginal yeast infections. For the suitability, posaconazole delayed release tablets are contraindicated in people with known hypersensitivity to posaconazole, and it costs around 579 rupiah. That's it from me. Thank you.
Thank you, moderator, for the opportunity. Let me introduce myself. I'm Muhamad Hudaya with 3 last digits student registration number 093. For pharmacokinetic, fluconazole have absorbed with bioavailability 90%, and then for the distribution, it has 11 to 12% of plasma protein binding with excellent tissue penetration. And then for the metabolism, it metabolism via cytochrome P450 enzyme system. And then for elimination, it have 20 to 50 hours of half time, and then 80% of total renal clearance. And then for the pharmacodynamic, it depends on the dosage, fungal organism with being treated, and then the context of the infection. For the area under the curve, ratio have important parameter to predict the efficacy of fluconazole. And then we solve in the table the interaction of fluconazole with another drug and then the effect on the patient. For the efficacy, fluconazole have extremely effective treatment for vaginal candidiasis. This medicine acts by blocking the synthesis of ergosterol. And then fluconazole have contraindicated with patient with hypersensitivity, and then the patient with hereditary fructose, glucose, or galactose malabsorption and sucrase isomaltase deficiency. The dizziness or seizure may occur from time to time. Thank you.
Thank you, Doctor and the moderator, for this section. Firstly, let me introduce myself. My name is Komang Chandra Yogananda with last three digit number is 091. So in this section, I will explain about the data in the table. Based on the given data, clotrimazole is an antifungal medication that demonstrates high efficacy with rating of 3+. It also has a good safety profile with rating of 2+ and high suitability with rating of 3+. Moreover, clotrimazole is relatively affordable, priced at approximately 13,000 rupiah. Therefore, considering its effectiveness, safety, suitability, and affordable cost, clotrimazole can be recommended choice for treating vaginal fungal infections. That's all from me. Thank you.
Please let me introduce myself. My name is Yohanes Putra Sunardi with the last digit number 089. The drug that can be used as the first choice in the treatment of candidiasis is clotrimazole. Clotrimazole is an imidazole class of drug that has broad antifungal properties in treating infections caused by fungi, especially candidiasis caused by Candida species. Clotrimazole is also a drug that is available over the counter, making it easier for patients to get the medicine. In addition, there was no interaction between clotrimazole and amoxicillin, so it's safe for consumption. Once more, the resistance of the fungus that cause candidiasis to clotrimazole is very rare, making the drug the main drug for treating candidiasis case in women in the next upcoming years. The clotrimazole in treatment of vulvovaginal candidiasis is carried out vaginally in the form of cream and pessary preparation. Clotrimazole cream dosage form can be found based on its concentration level, namely 1%, 2%, and 10%. As a 1% or 2% cream, apply thinly and evenly to the external anogenital area for at least 2 weeks. The applicator is available in clotrimazole 10% cream dosage form. As the 10% cream, take 5 grams of cream using the applicator full and enter it intravaginally, preferably at night. Clotrimazole pessary dosage form can be found in several doses, namely 100, 200, and 500 milligrams. The use of dose of 100 milligrams is carried out by inserting a pessary daily for 6 consecutive days, a dose of 200 milligrams daily for 3 consecutive days, while a dose of 500 milligrams is a single dose.
I'm Angelica Fortuna Ongawan with the last 3 student registration digit number 092. Okay, so the prescription consists of several components. There should be the prescriber identity, which is the doctor, including name, license classification or SIP, address, and office telephone number. The place and date of the prescription must also be stated. Here, it was written at Denpasar on 26 May 2023. And then there is a prescription part that is written as the R/symbol, which then followed by the inscription. Inscription contain the drug name and the quantity, which is clotrimazole cream 1%, 10 grams, tube number 1. Clotrimazole is the generic name, cream is the drug form, tube is the drug packaging, and number 1 means the quantity of the tube that should be given. And then on the second line, there is this S symbol referred to signatura, which contain the instruction of the drug use. UE is usus externum in Latin, which means external use only. 2DD is bis didier in Latin, which means 2 times a day. Applic pardol in Latin means apply to the painful or problematic part. In this case, it's the vagina. M at V is mane at vespere in Latin, which means morning and night. After the inscription, the prescriber or doctor must end it with an underline and a signature or initials. The prescription must also include the patient's identity, that are name, age or weight, and address.
Thank you for the time, moderator. My name is Juanda with license number 095. And now I'm gonna explain about the evaluation of this case. There are four types of evaluation that we can do on this case. That first one is medical history, which is obtained through details regarding the patient's medical history, including any instances of vaginal infections, STDs, or other pertinent disorders. The second one is physical examination. Conducting a pelvic examination is necessary to determine the nature of the vaginal discharge, check for any indications of inflammation, and check for any abnormalities in the cervix and vaginal walls. The third one is laboratory test, which we take a vaginal swab or sample of the discharge to be examined under a microscope and or cultured to check for the presence of the yeast or other pathogens. And the last one is stop therapy, which in this case, the patient is exhibiting signs and symptoms of a vaginal yeast infection, which is frequently brought on by a species of Candida. It is appropriate to think about ceasing the amoxicillin therapy because it may have contributed to the growth of the yeast infection, given the patient's clinical presentation and the absence of any other alarm findings. That's all from me. Thank you for listening.
My name is Gede Darmawan with last three digit student registration number of 100. In communication, information, and education, there is several key components that must be conveyed to the patient as shown in my slide. I will be giving example in this scenario. Hello Miss Ani, my name is Dr. Fajar. I decided to prescribe you clotrimazole because it worked by altering cell wall permeability, therefore stopping this infection, and there was no interaction between clotrimazole and amoxicillin, so it is safe. The duration of the treatment is at least 2 weeks. Potential side effects include vaginal irritation, pain, swelling, itching, or burning sensation. If there are any rashes, breathlessness, swollen mouth, or eyes, stop using the medicine and inform me immediately. If these side effects do not go away or are severe, the symptoms worsen or do not improve, please contact me. The clotrimazole cream should be applied 2 times per day, morning and night, and apply thinly bit or tape onto the external anogenital area or the painful part. Avoid any direct contact with clotrimazole cream with your eyes or mouth and wash your hand after application. If this medicine accidentally gets into your eyes or mouth, please rinse it immediately and inform me if you start to have any problem with your eyes. You must complete the full course of the treatment, even if the symptoms improve before completion. This is to prevent potential recurrence. You should also avoid using doses as this can disrupt the vaginal environment and exacerbate the symptoms. That's all from me. Do you have any question? And that is how to do communication, information, and education to the patient. Thank you.
Alright, we have come to the end of our presentation. I'd like to say thank you for all your attention and this opportunity. And I'd like to close this presentation with Paramasanti. Om Santi 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 Om.